Welcome back to Open Exchange. I'm Wole Famrewa, and before we move on to the market, according to KPMG, Africa is not a healthy continent, as it lags behind the rest of the world and behind poor countries in Southeast and South Asia that were behind Africa when measured on some metrics a few decades ago. The gap is largely due to the HIV/AIDS epidemic, which hit Africa harder than any region on Earth in the early 1980s. And to discuss advancing healthcare in Africa, I'm joined in the studio by Dr. Ola Orekunrin. She's the founder of Flying Doctors, and Alex van der Heever is the chair Social Security Studies at the Graduate School of Public and Development Management at Wits University. He joins us, of course, in the studios in Johannesburg. And I want to start with you, Dr. Orekunrin. Can you just give us your thoughts about, let's talk a bit about what you're doing, because I know that you're doing some really cutting-edge stuff in terms of advancing healthcare in Africa. You are planning to start a school to train paramedics. Yes. And even the culture of paramedics in a place like Nigeria seems to be way out. So can you just talk to us about the challenges you are experiencing in terms of bringing such innovation to healthcare in Africa?
Thank you. Now, I think that there are three probable main issues with healthcare in Africa and healthcare delivery, particularly in Nigeria. Number one, as you might have seen yourself, I think there's an issue with our public health. Yeah. In terms of people aren't actually aware of the symptoms of acute illness. And I talk about acute illness because my specialist interest is emergency medicine. Sure. So I know that HIV, AIDS and malaria are huge problems, but what I see on the ground as an immediate care physician is actually a lot of trauma and a lot of acute problems. So I noticed that if you compare awareness in the West and Africa, you find out that most people, even middle-class people in Nigeria, do not know how to give CPR. They don't know how to use a defibrillator. Right. They don't know how to recognize the symptoms of a stroke. Right. And I've been on the motorway. I don't know how much time you spend on the motorway. I spend a lot of time on motorways in Nigeria. I'm sure you do. And I see car accidents with people, acutely bleeding, head injuries. And what I see going on around that person, they usually somehow summon a man in a white dress, a barefooted man in a white dress, to start praying while this person exsanguinates half of their blood volume. Right. And I think that this is a lack of public health education. We also see a lot of women, for instance. We have a high maternal mortality rate in Nigeria, and we see a lot of women that have spent 3 hours in church, hemorrhaging before they're actually eventually brought to the hospital when it's often too late. So there's a major public health issue. And I think that if we can just get the education out there about the symptoms of acute disease and what to do when you find somebody that is acutely diseased, will solve half of our healthcare problems. All right, so you think the issue is education here, but if I can bring you, Alex, into the conversation, your thoughts about the role of government in driving healthcare in Africa. And one gets the sense that, the general issues we have in Africa, corruption, etc., have plagued the healthcare sector in particular. But can I just get your thoughts on the big issues and the role of government in advancing healthcare on the continent?
Healthcare systems struggle to evolve coherently without some stewardship from government. Private health systems can evolve without direct government involvement, but many things get left out that, for instance, don't respond to sort of commercial imperatives. And when we look at a lot of countries in Africa, including South Africa, we see, for instance, that the public delivery systems have been very weak and unresponsive in a number of areas, suggesting big problems in the accountability frameworks of public systems. The expenditure levels in much of Africa on public health is, let's say, through the public sector, is relatively good, but the outcomes are very weak. Countries like Nigeria and South Africa are outliers in terms of maternal mortality ratios, which are a proxy indicator of the performance of the general health system, the public health system. But on the private sector side, what we've seen is that because of sort of very limited funding on the private side, you've had quite limited development of provider systems, which are desperately needed in much of Africa. But the economic growth rates there are starting to change things, but in the absence of a coherent government policy framework in general.
Right. Dr. Ola, I want to get you back into the conversation here. And of course, you're an entrepreneur. Talk to us about the the entrepreneurial spirit that needs to be brought to bear. I know a lot of returnees from diaspora are coming into even healthcare in Africa.
Absolutely.
So talk to us about how that entrepreneurial spirit can overcome the challenges that we're seeing on the continent.
Well, I agree with my colleague in South Africa that the government does have a role to play, but I think that real change in healthcare systems comes from private sector.
Right.
And it comes from two things. It comes from better education and better innovation. Now, I think that Africa and Nigeria especially is poised to bring about innovation in healthcare. I think that if you look at the way that we've managed to sort of lead in our mobile money, in our sort of mobile apps and systems, you can see that a lot of the things that we're doing in Africa in the tech space are actually far beyond what is being done in the tech space, even in the Western world. And I think that if we can do that in the mobile area, the tech area, then we can definitely do that in healthcare. And I think that a problem is that the devices that we use, a lot of the technology that we rely on healthcare is not actually suited to the African environment.
Right.
I think it's far too expensive to deliver the sort of widespread healthcare that we need.
Right.
And I think that sometimes the functionality is not really what we need either. And I think that we keep on relying on these technologies because we think that the West are the only people capable of producing these technologies. But I think that we're in exactly the right place to start producing African solutions, healthcare solutions for our African problems. And I even think that we can go a step further and actually start producing devices, cheap, cost-effective devices that we
Right.
can export to the rest of the world.
Right.
And personally, I think that our healthcare solutions, cost-effective healthcare solutions, are more likely to be found in Aba than they are to be found in Samsung.
Right, of course, Aba is in southwest Nigeria. Okay, let me bring you back in, Alex, and your thoughts about still with staying with the public sector's role in all of this. She mentioned technology as something that could be a game changer. Can you just talk to us about how technology can also be applied in the public sector?
Well, I think a concern with public sectors is at the moment is that they lack the drive, the bottom-up drive to be innovative in delivery. And what you're seeing, and I would agree fully that what you're seeing a lot of the time in the African context in terms of innovation is going to be far more interesting than for instance, what would happen in the very well-funded private systems or public systems in Europe and in North America. But it will also be far more innovative than what's happening in the public sector. The pressure is typically not on. They're very badly run, very badly governed services on the whole, and therefore they operate at a very sort of low level of productivity. While African private systems are likely to be quite innovative, primarily because of the resource constraints, the financial constraints, that you don't have properly insured markets and you have a lot of people paying out of pocket, it will actually put a lot of pressure on providers to provide innovative solutions. But what will happen ultimately is that insured markets will evolve fully and provider systems will deepen. And at that point, you might have inefficiencies built into the system. South Africa is an indication of that our private systems, rather than being very innovative, are very, very expensive, very technology heavy, very inappropriate technology heavy. And but we have in the African public and private systems, we have the possibilities of using technology very differently to the way the rest of the world does. At the moment, technology is not responsive to price and quality indicators in the market because those tend to be largely invisible. So it's also where government does have to come in at the end of the day, is to become part of creating a framework in which both public and private systems can be intelligent purchasers of healthcare. And if they are,
right,
you're going to nuance new technology.
Right, Dr. Ola, I want to get your thoughts on the issue of cost, because clearly in Africa, poverty is a big issue. So delivering these services in a cost-effective manner is always the big challenge. And unfortunately as well, what we find is that healthcare, in many governments, it really is something that they put on the back burner in terms of priority. So we don't see that much investment in terms of budget allocations to healthcare. So how do we overcome this challenge in Africa, given the fact that it truly is a poor continent in terms of income levels.
Yeah, it's a poor continent in terms of income levels, and the news is, if you look at the infographics looking at beyond 2015, 2020, you'll see that most of the world's poor are actually going to be in Nigeria and India, and that's factual, and that's been statistically shown. So we need to start thinking, working with our engineers, homegrown solutions, and working with our engineers, working with our healthcare professionals to come up with innovative ways of delivering healthcare. The West, that are cited as the perfect examples of healthcare, their costs are spiraling out of control. They've designed systems that are completely financially unsustainable.
Right.
And we not only need to produce these healthcare solutions for our own countries, but we need to produce them to help the West as well with their own healthcare problems.
Alex, do you want to share some thoughts on that point?
Yeah, I think one of the things is understanding the reasons why a lot of healthcare is overpriced in the West and in these sort of very advanced countries. It is very problematic to treat those countries as benchmarks. They are not benchmarks. They accommodate very high costs in their system. And it's because they accommodate them that the system becomes very, very expensive. And then what happens is that developing countries try and import that technology at that cost. And those sectors are unwilling to translate that. Therefore, the issue is really, I think, structurally, how to buy these services more intelligently, to drive that innovation domestically, to protect it over time. Because I think at this point in time we will see innovation, but we may see it killed over time as more resources, more financial resources are actually directed in at the health systems in Africa.
All right, Alex, thank you for joining us. Alex van der Heijver, she's the Chair, Social Security Studies at the Graduate School of Public and Development Management at Wits University. And thank you so much, my guest in the studio, Dr. Ola Orekunrin, founder of Flying Doctors, giving us, of course, their thoughts on advancing healthcare on the continent. We'll move back to the